So, our first speaker is going to be Christie Offenbacher. Did I say it right? Okay, so they're going to correct me because this is a very aggressive group here. She's a clinical social worker and a therapist in Brooklyn, New York. Not part of the mainland, but it is still part of the United States. She serves on the Political Education Committee in her local Democratic Socialists of America. Let's hear it for the DSA. And also as a regional coordinator with the National Medicare for All campaign. Let's give it up for Christie. Oh, I have to remind you, I was told that at 9:30, somebody in this room is going to turn into a pumpkin if we're not done. So we have a very strict 5-minute thing for speakers. So I hate to do that to you. But.
Luis grew up supporting his single immigrant mother, following the murder of his father near his home in Bushwick, Brooklyn, on earnings from a drug run he'd taken up at 8 years old. When I met him, he'd spent the last 30 years of his life in and out of prison, bearing the cost of an economy that had for so long already abandoned its poor. The paperwork he brought in from the hospital indicated he was homeless and schizophrenic. In our initial meeting, he told me how often he is visited by the voice of his childhood best friend, whose rape and murder he was forced to witness as retaliation for a drug deal that went wrong. He woke many times each night at noises that resembled the sound of someone breaking in, to steal his few possessions or to harm him or a loved one. In the daytime, he feared flashbacks that brought him involuntary episodes of blinding rage, violent, directionless anger. These kept him from the art museums he loved, from the science and history exhibits that reminded him of his mother, of walks with her in Central Park, ice cream in hand. By the time he reached my office, Luis had been through 5 interrupted psychotherapies with 5 different psychotherapists and upwards of 25 episodes of treatment on different medications to manage his schizophrenia and, by those who even registered it, his PTSD. His medical and mental health care, both in and out of prison, had been intermittent at best, neglectful at worst. When, after 6 months, on a waiting list, he finally gained admittance to the clinic where I work, Luis was desperate to speak with a psychiatrist as soon as possible. He knew what meds he needed to calm the voices, he said, if only he could find someone to fill the prescription that had lapsed 6 months before. My name is Christie Offenbacher, and I'm a social worker and therapist at a public mental health clinic in New York City, where I also serve as the Northeast Regional Coordinator for the Democratic Socialists of America's Medicare for All campaign. Although in my professional capacity, I'm supposed to have officially sworn off having favorites, I will admit to you here today that Luis was one of mine. While his specific character, his sense for life, and his manner of communication are utterly unique, the major contours of his story are too often shared by others I see. It was in my work with him, and there's others, that I learned how Medicaid, while it offers free at the point of service care to so many Americans to whom it would otherwise be unavailable, as a means-tested system with severe limits to who it will cover, it's a mess. Community mental health clinics of the sort I know, of the sort I hear about from colleagues across the country, are a nightmare and a failure. And the people they fail, people like Luis, do not just disappear. They can't resort to other social resources like family, friends, and communities when those too have been burned by economic, legal, and environmental devastation. Since the 2015 announcement that Cook County Jail had become the largest provider of mental health care in the country, we know that many of these people are made to spend their lives being shuffled through the American prison system instead. And so, mental health care is a particularly acute example of the absurdities of our for-profit healthcare system. On the one hand, for those who can afford them, medications abound for an increasingly diverse array of diseases which are themselves often manufactured thanks to the deep ties between the American Psychiatric Association and Big Pharma. Pharmaceutical companies target chronic diseases like mental health, mental illness, because the people they afflict are dependable, that is to say, dependent consumers. It's sick. On the other hand, and for those without the means, those like Luis, who are often most in need of help, our mental health system is inhumanly and grotesquely cruel. When healthcare is run for profit, we get a host of cost-saving measures and ideologies of patient responsibility that do nothing to promote thoughtful reflection by patients or providers about what would really constitute those ideals of health and well-being that we supposedly cherish. When healthcare is run for profit through a means-tested system, we keep our providers' hands tied up in administrative and bureaucratic processes. Therapists are made to rush through complex and sensitive cases like Luis's in order to complete the piles of paperwork needed to justify his treatment in overcrowded and understaffed facilities. So, as a healthcare provider, Medicare for All represents a chance to create more functional and adequately staffed clinics. It means the redirection of time and labor currently wasted on administrative obstacles of a means-tested program toward direct service provision for those who need my clinical time and attention. But as a socialist, Medicare for All means even more. Capitalist society has failed patients like Luis many times over. The creation of the first truly universal social program in the history of the United States is an opportunity to raise awareness that people might simply access the basic resources they deserve and to glimpse just how much the profit motive has made our collective lives worse. In other words, Medicare for All has the potential to change the way that people think about society, what they contribute to it, and what they deserve from it. Luis suffers daily from excruciating mental anguish, but more insidiously, he suffers under the crushing weight of a cruel and exploitative society. For the past 40 years, we've been living under the direction of unregulated capitalism, which has made waking life a living hell for poor and working people. The current struggle for Medicare for All represents the first major structural counteroffensive against the 1%. I am and will be so proud to stand with my patients and coworkers, with my comrades in DSA, and with all of you in this historic fight against the ruling class.
Thank you, Christie. You know, the most egregious violations of human rights occur in the mental health system and the healthcare system as a whole. We see it all the time. That's why we have so much depression and violence in our society as well. And we call it the hospital-to-prison pipeline at this point. 53% of all men in state prisons have a diagnosed mental illness, and 73% of all women in state prisons have a diagnosed mental illness. That's unbelievable. So now let's move on to the farm. We have Leslea Hodgson, who runs a farm with her husband in Fillmore County in southern Minnesota. You know, Gene Ross told me it's not Minnesota. You have to say Minnesota. So here's Leslea. Let's give it up for Leslea.
Thank you. I'm Leslea Hodgson. I'm a member of the Land Stewardship Project's Healthcare Organizing Committee for rural Minnesotans. I have issues with the status quo healthcare system. Together with my husband, I graze cattle, sell the beef, and run a cabinet shop on our southeast Minnesota farm. Before we began farming and working independently, we had jobs that provided partial cost share on a group policy. After 15 years of the struggle of trying to farm and work off the farm to get health care coverage, we decided to dedicate our energies to our own enterprises, raising livestock and building the cabinets in the shop that we had built. Because the cattle herd had grown and the cabinet shop had picked up more orders, we realized that to properly care for our livestock, and now after I realize how many nurses are in the room, you'll know when the vet leaves, after the vet wraps that wound up and sticks them with the shot and they leave, then that 1,200-pounder is yours to get home. So I'm the nurse of the cows, and working for ourselves meant buying health care in the individual market, though, which we did for about 3 years until the deductible, the letter came in the mail and the deductible was raised without our consent. I didn't know they could do that. And the premiums rose yet another 25% that year, which they had been doing year after year. We've tried since then to take an off-farm job to get health insurance, but it would only cover one of us at a time, or if we did want the other one covered, by that time then the premium became so high that these jobs, there's not enough left in the paycheck, like to maybe cover the fuel that it takes to drive 40 miles to get to the job in rural Minnesota. So we did what we could. Let's see, we purchased a policy off the individual market for which we both had high premiums and a high deductible, so we could never actually go to the doctor. And if we did, we would end up going into debt to do that. Felt like we were being ripped off and our premiums were not being used for us. Like our policy is the type of insurance policy that many insurance companies would like more of, like money for nothing. So we decided to go with the nothing option and discontinue insurance. But a farm accident or a serious health problem would have ruined us during this time. And finally, in 2014, we found out about Minnesota Care and qualified for a good comprehensive insurance with no deductible and a low premium cost. So we couldn't find that type of policy on the open market, and the high deductible premium out-of-pocket policies that they call affordable are not health care at all. They're just catastrophic care. That kind of policy will leave us open to huge medical debt, bankruptcy, and losing all that we have worked hard to build. We need solutions for everyone, no matter who you are or where you are. I hope we can make a change. It's unfair what's happening. And organizing like we do with Land Stewardship Project is what won Minnesota Care, because they're trying to get rid of that every chance they get. And it's really important for a lot of people. And so hope we can win health care for all. Thank you for listening to my story.
Thank you, Leslea. That was incredible. Next up is Rebecca Wood, who's from Virginia, and she actually told her healthcare horror story in the U.S. Senate the day Bernie Sanders introduced his Medicare for All bill. So let's give it up for Rebecca Wood.
I started fighting for healthcare during January of 2017. Prior to that, I had never been to Capitol Hill or had an interest in politics. My daughter, Charlie, was born 10 hours into her 26th week of gestation. She weighed 1 pound, 12 ounces, and was the size of my hand. I joined the healthcare fight because her birth is a pre-existing condition, and even with private insurance, she relies on a Medicaid waiver for much of her care. Charlie celebrated her 6th birthday last month. When the big day arrived, I thought about that tiny 1-pound baby in the NICU. Her underdeveloped lungs fought for each breath. She winced and recoiled every time her thin skin was touched. I feared we were asking too much of her, yet Charlie fought to survive. Mostly, I remember the shock of how my seemingly normal pregnancy turned our lives upside down within a matter of days. Unbeknownst to me, this is when my fight for healthcare actually began. Her birth taught me that there is no such thing as good insurance. In my scramble to fulfill her healthcare needs, I disputed automatic denials, sought out affordable services, and fought to receive the benefits included in our insurance coverage. Despite the obstacles, we were lucky. I was able to find services for her. OT gave her the use of her hands. She wants to be a doctor and a drummer. PT made it possible for her to run and jump. Speech therapy is why she can talk and say, "Mommy, I love you," the sweetest words to my ears. Her developmental progress far exceeded her doctor's initial expectations. However, all of it came at a cost. I had to make impossible choices. Should I pay for her therapy or my overpriced asthma medication? Choices like these really aren't impossible. I choose to pay for hers and go without mine. One day, I needed an expensive dental procedure. Unfortunately, it was at the same time a therapy payment was due. Charlie's speech was emerging. I was afraid we would miss a window of opportunity in her development if we cut therapy. I chose to pay her therapy payment and put off my dental procedure. The decision cost me dearly. Due to the delay, an infection spread throughout my mouth and jaw. I went to the emergency department because the swelling in my mouth obstructed my airway. After a course of IV antibiotics, I was discharged. The next day, I had all of my teeth pulled, the infection drained, and parts of my jaw scraped away in a 6-hour procedure under local anesthesia. I could not afford to have it done under general anesthesia. I cried the entire ride home afterwards. I don't know what the worst part is. The excruciating pain, how I worry whether I'm drooling when I smile, how eating is awkward and challenging, or how I love jazz and I'll never play the trumpet again. In addition to the things that we can't get back, like time, opportunity, and quality of life, my family was financially devastated by the healthcare system. These losses are why I started to work towards Medicare for all. I'm lucky she survived. I'm fortunate she thrived. However, it shouldn't have cost me nearly everything. Her name is Charlie. She is why I decided to fight, but my battle for Medicare for all is for me. I have to believe all of this happened for a reason. Thank you.
You have a beautiful smile. Didn't tell me it was going to be this hard. Unbelievable. What kind of human beings are running this country that this kind of thing, this is just, we know what kind of, I don't know. Isn't there a definition of human being? I don't think they fulfill. Okay, so now we're here from, Ashlea Bassham? They say, tell me. Bassham? Ashlea Bassham, who is a teacher in Logan County, West Virginia. And was a leader in this spring's mass strike of teachers that just rocked the world. And she's very nervous, so let's make her feel really good.
Thank you. The wine helped with nervousness, so thank you all for having me. My husband and I are both public employees in the state of West Virginia. He's a corrections officer. I'm a school teacher. As public employees, we hoped that the benefits package that sounded so great would sort of sweeten the sting of being at the bottom of the average wages for our professions. For several years, this has been true. But over the past few years, specifically, we've noticed creeping costs in our health care, as well as just changes to our benefits packages, rising premiums and deductibles, more expensive medications, fewer in-plan providers, prior approval being needed for just even the simplest of tests or procedures. The list just goes on and on. In February, West Virginia made headlines with what's misleadingly been labeled as the West Virginia teachers' strike. While teachers were the most vocal of the group, most teachers have really big mouths and like to hear themselves talk. I'm one of the quieter ones. We were joined in our fight by bus drivers, by our secretaries, by our paraprofessionals, by our custodians, by our cooks, our superintendents. Thank you. Our superintendents even stood with us, and they canceled school for the days that we were out for the work stoppage. Low wages and a ton of anti-public education bills that were being introduced were definitely part of why we went out. But it was never just a teacher strike, and it was never just a strike over low salary. The main reason that we had this collective outrage was the fact that there were these changes being proposed to the Public Employees Insurance Agency, or PEIA, which is the agency that provides health care coverage for the over 200,000 West Virginia public employees. We were joined in our fight, and we were supported by the other public employees because we were fighting for them too. So it was never just the teachers. Some of the approved changes to PEIA that fueled the movement included the increase in premiums, increased deductibles, increase in our prescription costs, these things that we'd become used to. But then there were some unexpected changes. One included a reconfiguration of the salary index codes that were used to determine our premiums. The reduced number of indexes went from 10 to 5. Family household income was to be used to figure out which bracket that we would be in. So these changes were going to make a big impact on how much we were paying for health care. What was particularly important for my husband and I was the fact that the employee and employee spouse tier was being just eliminated. This gave us a little discount each year because we both worked for the state. It wasn't going to be there anymore for us. All of these changes led to additional costs, and our salaries remained stagnant. And I wish that I could say that the changes stopped there, but I can't. We began receiving vague letters regarding a new voluntary program called Go 365. And at first it sounded like a genuine incentive plan to promote wellness of the employees. I have some friends in Florida who have Go 365, and they love it. Theirs isn't like ours was going to be. We found out that opting out of this voluntary program was going to cost us. It was going to be an additional $500 a year on our deductible, plus an additional $25 a month on our premiums. We also found out that there were a certain number of points that you had to have each year, and that point threshold went up each year. It started at 3,000, then 5,000, and then by the third year, 8,000. And if you didn't reach those point goals, you had the same penalty as if you just hadn't participated at all. So you still had that deductible increase, you still had the premium increase. And we had to track those points, and the preferred method was through the Go 365 app, where we were encouraged to use something like a Fitbit or an Apple Watch, something like that I used to track my steps. To not only just track our steps, to track our sleep, to track our workouts that we did not complete. It could even track our location. So this was invasive, and we didn't want any part of it. So we fought, and we won, sort of. We had a 9-day work stoppage, and the most harmful anti-education bills either died on the floor or in committee. We received a 5% pay increase for all West Virginia public employees, not just teachers. And the approved changes to PEIA were frozen for 16 months, and a task force was established to handle the problems. But there's still no long-term funding solution, and a freeze is not a fix. PEIA needs an additional $50 million at least per year. And West Virginia, we just bleed out revenue. $200 million a year lost to cuts in corporate income tax. Our state won't increase the revenue or increase the tax for the natural gas severance taxes, and they've done away with the business franchise tax. And I know that these problems aren't unique, and that's what makes it even more important. Working people across the United States, we shouldn't have to fight so hard to be able to go to the doctor, to be able to buy our medicine. We shouldn't fear bankruptcy because we get sick. We shouldn't have to attend meetings with our governor and this appointed task force where we have to share our sad stories, and they tell us, I'm sorry for your luck, and we give solutions, and our solutions just aren't good enough. We shouldn't have to go on strike and bargain for something that should be a right rather than a privilege. Though funding of PEIA is our immediate concern, healthcare costs, they're still going to keep going up and up and up, and there's always going to be a need for additional funding. Medicare for All would assure access to affordable healthcare for everyone. This West Virginia teacher and many other West Virginia public employees are committed to continuing the fight. So, thank you all.
So Ashley went over time, but they speak a little slower in West Virginia, so that was okay. I was asked to just share a little bit about what's going on in Puerto Rico. In no place that's part of the United States do you see the injustice in healthcare more than you see it in that island. And it's kind of a place where the convergence of climate change, colonialization, and healthcare injustice converges. We at NISNA, and I know that many nurses, how many people in this room had gone? Any nurses went? Great. So, aside from, we have a farm there, but NISNA did many missions there. I went there 6 times after the hurricane, in addition to some other places. And, we crossed rivers and went up landslides. I mean, the situation there was outrageous. The privatization of healthcare that's been taking place over time, the destruction of the public healthcare system, the lack of infrastructure in the electrical system directly contributed to the deaths of more than 5,000 people, which was covered up for 9 months. We went into homes where we spoke to people who said they had to watch their grandmother die in front of their eyes because there was no electricity for nebulizers, there was no oxygen, there was no way to get dialysis. There was no refrigeration in morgues, so they buried their relatives in backyards. It was unbelievable. We have never seen a hurricane like that before, and we have never seen a healthcare system in such disarray. A doctor a day was leaving the island even before with the Austerity and the Promesa Act. It is, it's kind of like, I hate to go back to this literature theme, but in A Christmas Carol, when the ghost comes and they see the current Christmas and then the Christmas of the past and then the Christmas yet to come, Puerto Rico is the Christmas yet to come for the United States. If we don't stop this, that's what's going to happen here. We've got to do something about this now. I mean, there's a lot more to say. Hopefully we'll be able to do something. People there are fighting back. The privatization of the closing of 300 schools, conversion to charters, very similar to situations that we see in the rest of the country, all the stuff that's going on with the electrical system and privatization. It's so clear that privatization is so much linked to the destruction of everything that we know. Because a public health care system, Medicare for All, would give us a public health infrastructure, so we wouldn't see what happened in Katrina, we wouldn't see what happened in Harvey, we wouldn't see what happened in Sandy, and we certainly wouldn't see what happened with Hurricane Maria and Hurricane Irma.